Welcome to the JEADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights 4 articles in a selection called Editor's Picks. Today we explore the Editor's Picks for June 2024, selected by the JEADV Editor-in-Chief, Professor Carl Paul. Cardiovascular Protection with TNF Inhibitors. Biomarkers in Rosacea, Insight into Pathophysiology. All you should know about actinic keratosis prevention and treatment. Beware of Xylazine, the Tranq Dope which can cause major necrotic ulcerations. But before we get into that,
we are excited to announce you can now register for this year's Congress hosted in Amsterdam and online from the 25th to the 28th of September 2024. The JEADV Congress is one of the largest international meetings in Europe focused on dermatology and venereology, and the packed 4-day program covers the entire spectrum of specialties. This is an excellent opportunity for you to join delegates from all over the world and exchange knowledge, network with like-minded professionals, and develop your career. Find out more at eadv.org/congress.
And now the editor's picks. Don't forget that all articles discussed are referenced in our show notes. Article 1. Cardiovascular Protection with TNF Inhibitors. Patients with psoriasis, inflammatory arthritis, and inflammatory bowel diseases may be at increased risk of acquiring cardiovascular diseases. In a rigorously performed systematic review and meta-analysis of 27 studies, Xylazine et al. Evaluated the influence of TNF inhibitor treatment on cardiovascular risk in patients with immune-mediated inflammatory diseases. Despite the observational design of most studies, the analysis suggests that TNF inhibitors are associated with a 26% reduced risk of major cardiovascular events compared with patients treated with conventional immunosuppressants. See Figure 1. Earlier use of TNF inhibitors may mitigate cardiovascular risk in IMID, especially in patients with risk factors. Article 2. Biomarkers in Rosacea, Insight into Pathophysiology. Rosacea remains one of the most common facial dermatoses, negatively affecting self-image, self-confidence, and quality of life. In this systematic review of studies reporting on 119 rosacea biomarkers, Geng et al. Summarized the current knowledge of rosacea pathophysiology. Demodex density and markers of innate immune system activation appear to play a major role in triggering rosacea lesions. See Figure 2. The most commonly reported biomarkers were interleukin-1 beta, TNF-alpha, interleukin-37, IFN-gamma, and MMP9. In the context of this heterogeneously presenting disease, more work is needed to determine the clinical utility of potential rosacea biomarkers. Article 3. All you should know about actinic keratosis prevention and treatment. In this comprehensive European consensus, major European dermatological societies updated recommendations on actinic keratosis management. See Figure 3. As the most frequent neoplasia, AK represents a manifestation of UV-induced field cancerization. Destructive treatment with cryotherapy, curettage, or laser is appropriate for single lesions, and field treatment either topically or with photodynamic therapy is recommended for multiple lesions. Preventive use of topical agents or chemoprevention with nicotinamide or retinoids are options in patients with rapidly relapsing lesions. Finally, patient education regarding emollients and sun protection is warranted in the interest of cancer prevention. Article 4. Beware of Xylazine, the Tranq Dope which can cause major necrotic ulcerations. Xylazine, a non-opioid pain reliever developed as a sedative and muscle relaxant for animals, can be obtained inexpensively from international suppliers. In combination with other sedatives like fentanyl, benzodiazepines, or alcohol, it can increase the risk of overdose and death. Xylazine use is notably associated with necrotic skin ulcers, caused by drug-induced vasoconstriction, occurring distally to IV drug injections, requiring complex multidisciplinary management. See Figure 4. Whilst most cases of xylazine-associated ulcers have been described in the USA and Canada, the drug has unfortunately recently been introduced in Europe. Just to recap, our first article was Reducing Cardiovascular Risk in Immune-Mediated Inflammatory Diseases, Tumor Necrosis Factor Inhibitors Compared to Conventional Therapies, a Systematic Review and Meta-Analysis, by Xylazine and co-authors. Our second article was Biomarkers in Rosacea, a Systematic Review by Geng and co-authors. Our third article was European Consensus-Based Interdisciplinary Guideline for Diagnosis, Treatment and Prevention of Actinic Keratosis, Epithelial UV-Induced Dysplasia and Field Cancerization on behalf of European Association of Dermato-Oncology, European Dermatology Forum, European Academy of Dermatology and Venereology, and Union of Medical Specialists by Kandorf and co-authors. And our fourth article was Necrotic Skin Ulcerations Caused by Xylazine in People Who Inject Intravenous Drugs by Oskowitz and co-author. Of course, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and though you can find free access and open access articles, EADV members benefit greatly by having access to all articles and content.
Before you go, a quick favor. If you're a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you're interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode.
Thank you for your support, it means a lot. We look forward to hearing from you. Until the next episode, take care of your skin.